Governor, good morning. 2 weeks ago, Blackhawk had 12 cases. Today, 366. Some of them being traced now, or most of them back to the Tyson plant. So I think everyone realizes, Governor, that you're in a very, very difficult position when it comes to calls to close a plant like Tyson's in Waterloo with 20,000 hogs a day in an industry already being really hurt. It's kind of an actuarial decision. You're weighing the negative economic impact versus the potential risk to public health. So tell us why you still think it's worth the risk to keep that plant open.
Well, first of all, we want to make sure that we're protecting the health and well-being of all Iowans. And I want people to know that probably, 50 to 70% of the United States population is projected to get this. So people are going to get it. It is very contagious, especially in large gatherings. So our goal, and 80% of the individuals that get it are only going to experience mild or no symptoms. So we shouldn't lose sight of that as well. So we really need to focus on the individuals who are vulnerable, who have underlying conditions, and do everything we can to mitigate their exposure. To stay home, to limit, trips to essential trips, to do what we can to flatten the curve, which we're working on, so we don't overwhelm the healthcare system. And so, by going in and being able to have Iowans across the state take the assessment, again, to see where they're at, use a strategic testing and follow-up, we can start to identify, start to do the contact tracing, see the scope of who has been involved, and most importantly, make sure that we're taking all precautions necessary to protect the health and well-being of our workforce, but also to get them through the incubation period and then back to work. And so with the serology testing, that's going to be extremely helpful because we'll be able to identify. A lot of times Iowans don't even know that they've had it, and I think we're seeing more and more numbers indicate that that's happening with the percentages that I just talked about. So this will be an opportunity for us to also see if Iowans have had it, if they've recovered, what their immunity is. We're still learning that. We don't have all the answers there. But then that starts to go into some of our projections about bringing our workforce and standing them back up. So we're working with the facilities to make sure that they're taking all precautions that they should to protect their workforce, masks, face shields, sanitizing the place. They do this and have done this on a daily basis. That's standard practice. Making sure that they're doing screening before they even enter the plant, taking temperatures, limiting the breaks and how, separating the employees, partition shields that they're putting in place. So they're doing that, and then we need to work with the workers to make sure that we're doing an assessment, see if they are showing any symptoms, that we're getting the test done and getting them on the road to recovery.